Vitiligo is one of the conditions that is very hard to manage. However, before I tell you about the treatment, what is vitiligo? Now, vitiligo is one of the conditions that affect your cells that form skin color. These cells, you call them melanocytes. Now, in this case, you have your own blood cells that are supposed to protect you against infections, turning around and then fighting the melanocytes that are supposed to form for you skin color. Now, in this case, what you see on your skin is that oftentimes you will see you're getting patches of skin color change, which are becoming lighter and lighter, then eventually turning white, or what we call chalk white. Now, these patches that you see on your body will most cases have no symptoms. They will not itch, they will not pain. However, they will progressively be expanding, covering a bigger part of your body. Sometimes starting from around the mouth, starting from around the eyes, also starting from the genitalia. Now, these patches, once you see them, please go and visit a dermatologist when it's still early, because for vitiligo, for you to treat it successfully, you need to address it when it is still early. Now, who does it affect? Vitiligo can affect anyone in this world. However, it will affect only 2% of the general population, meaning that if you get 100 people, 2 of them can be having vitiligo. Now, this case looks to be rare. However, its impact on the social appearance, on the finances, on the psychology of an individual are a little bit out of proportion. Now, you find yourself that when you see it on some individual, please advise them to see a doctor when it's still early. So when they come in to see us, this is what we usually do. One, we shall assess you and know what is the extent of the condition, how much body surface area has it affected, where is it located, and then we shall explain to you how easy or hard is it to manage. Now, for some people, you find that they even give up on treatment and be like, no, this is normal. And you've seen very celebrated models like this one, going all the way to represent on magazines as people with vitiligo, because this is a condition that can occur to anyone and they are okay with that appearance. They call it their new look. Now, others feel a little bit less comfortable and they want it to be addressed. And in this case, you find ourselves either giving topical treatments to if the disease is localized, or sometimes you can give oral treatments and supplements in case it is a little bit more extensive. And in other cases, you can also use light treatments like phototherapy to try and address these skin color changes. Now, in case you see it, what should you be worried about? Since it is an autoimmune disease, you should also take blood checkup to see if there's anything else that is underlying. For example, you need to check your thyroid, you need to check your blood sugar to know if it is occurring with other autoimmune conditions. But in case it is occurring alone, maybe on the skin only, and nothing else is affected, then we can advise you on the treatment modalities depending on the severity, the extent, and the effects of this condition to your health. But remember, go and see the doctor as soon as possible such that we optimize treatment options before we are out of time. Thank you.